Okay, so the first blister we're going to tackle is a very common blister. It's one we see quite a lot, and you find it usually at the bottom of the base of the big toe here and the second toe, in this sort of notch in the first web space there. Now they can occur anywhere along the foot, it just depends on the athlete's foot, their footwear and their socks, but this is a particularly common area. And you'll find that as the race goes on, this blister might extend into the web space between the toes, or might go up onto the big toe itself. It's quite an easy area to dress, and so we're going to go through dressing this area now. The first thing to bear in mind is that this is where patients and runners will land, and where the weight of their foot hits the ground first of all. So this has got to be a nice robust dressing, so it doesn't shear off as the foot hits the floor. It slides slightly in the shoe forwards, and they push off through their gait cycle. Now it's quite important to make sure it's nice and robust. It's as firm and as tight as it can be without restricting the foot expanding and swelling and splaying as the weight of the runner hits the floor, and making sure that the toes can move freely. So we're going to go through dressing this one here. Now it's dead simple in terms of the equipment you need. A stirret, some needles that you can see here. My preference is to use tough cuts, the larger scissors, but many people will use the smaller fine scissors. Clean your hands with the alcohol gel and some gauze. Now in terms of dealing with blisters, our general principles are if they're flat to the skin, such you can run your finger over and you don't feel the bump of the blister, leave them well alone. Don't attempt to burst them. If you do think that it's raised and a tense blister that's above the level of the skin will act like a small stone in the shoe of the runner, give it a clean with a stirret, like so. 2 or 3 small holes just where the blister meets the skin and express that fluid out. Don't de-roof the blister, because you're going to put a dressing over that to stop any muck and grit going into the blister. But if we burst it while we're dressing it, it's done in a nice, clean and controlled manner, and the chance of infection is reduced, though by no means eliminated. Now, in this instance, we don't have any fleecy web available. It's all out in a field at the moment, but for demonstration purposes, we're going to use this elastoplast tape to demonstrate fleecy web, and it's a very similar colour. So the first thing to do, as I say, is to clean the foot, release any pressure from the blister, and clean the area up. If you use the alcohol wipes to clean the area, it does tend to make for a slightly stickier surface, but if the patient or the runner, as it were, has washed their feet, then you usually don't need to worry about doing that. Get your fleecy web, and it will come in strips between 5 and 7.5 centimetres long, and anything from 1 metre to 3 metres long. Just sort of eyeball the size of the blister, and trim your piece of fleecy web to the rough size and shape of the blister. Now, as a general principle, corners in dressings are a bad thing. What tends to happen is the edge of the corner will start to peel and then it rolls over quite nicely. So just take the corners off your fleecy web and just round them off a bit. And rounded corners move better and fit with the anatomy of the undersurface of the foot. So you might end up with a patch of fleecy web like so, and you essentially stick that down to the foot. Now, a few pointers to raise here. Number 1, and I know this isn't really fleecy web, but notice how you press all the way around the edge to make sure that edge is firmly flattened down. Number 2, try and just warm it slightly with your own hand to make sure that the adhesive on the fleecy web sticks to the skin as firmly as you can. Number 3, just make an assessment of how that dressing is impeding in the web space. Remember, these toes move against each other during the run or during the walk or during the expedition, and if you've got a corner of dressing in there that acts like a small stone, you're inviting more blisters to form on the inside edge of the second toe or the lateral edge of the big toe. That's the outside edge for you non-surgeons. Once you've achieved that and it's stuck down nice and firmly and you're confident you can't easily roll up an edge, it's time to press on with the taping. Now, the reason that we tape blisters as well as fleecy web them is really to ensure that that dressing is nice and robust and can stand up to the day's run or the whole race if you're lucky. Now, taping this area of the foot is quite tricky. As you can see, just slapping a piece of tape on is going to impede on the toes. It's going to make it difficult for the foot to flex and move. And remember that a foot doesn't just go up and down, it splays as you land on it. It twists and pronates and supinates as they go over uneven ground, and the toes need a full range of movement, otherwise the runners will fall over. Added to that, at the end of a running stage, you'll notice that patients' feet are bigger. They all buy running shoes slightly too big for themselves, because at the end, with the increased blood flow down to the area and the swelling due to trauma, effectively, that foot will be slightly swollen. So you must bear that in mind whenever you're doing anything circumferential. but particularly when you're taping feet. So how do we do it? This is the tape we use. It's effectively kinesio tape, and through trial and error over the years we found that this is the most successful tape to use. So we're going to cut a length approximately the right size to go around the runner's foot, and it is approximate because the tape is stretchy, as you'll see. What we're going to do is effectively look to reinforce our dressing by having an overlapping tape around the area like so, and that's going to hold that fleecy web on. It's going to provide extra frictional support to the foot but allow the foot to splay, flex and move. And it's quite tricky to do this in this area because, as you can see, the shape of the forefoot is not completely straight, and however you tackle it with the tape, it's not going to be particularly neat. So we need to bear that in mind as we do it. Very straightforward. Everybody has their own way of tackling this particular problem. My preferred method is to start by applying the tape. It's slightly tricky stuff, it does tend to stick to itself, but if you gently apply that over the area, and I appreciate that it's overlapping the toes for now, put it over the dorsum of the foot. That's the top of the foot for everybody who's not into that sort of thing, and make sure that the tape sticks to itself. If we turn the foot around slightly, what you might be able to see is just the tape's overlapping there, and it's quite crude at the moment, and that's purposeful. Back to the bottom of the foot now. Now what can we see? We can see that the big toe is slightly impinged. There's a bit of loose tape here which isn't stuck down to the dressing. That's going to attract dirt and grit. As you move through the lesser toes again, the little piggy here has bits of tape that's slightly loose. Now, general lesson, if you have a piece of tape, you fold it, it will ruck into small tags like so, like you can see there. This will act as a small stone, rub in the foot, cause more trouble, and they certainly won't thank you for it. So what we're up to now is pruning the dressing. So first of all, fitting tape into web spaces is very simple, and is usually just a case of splitting the tape like so and flattening it down. Now you can go into the creases of the toes. That doesn't cause a problem, but you must make sure that the tape is snugged down properly such that it moves comfortably and freely with the toe and doesn't restrict the extension of the toe or the flexion. If you start to restrict the extension, you'll either cause trauma to the skin there or make the runner unhappy, or your dressing will simply fail. And that's a little bit of pruning and error. So on this one here we can see just on the lateral side it's not quite stuck down there, so I'm going to free it up, stick it down there. Now at the base of the second, third and fourth toes, I'm reasonably happy with that. It's not going to restrict any of the movement. I can move the toe and the dressing doesn't come unstuck at all. If you look to the fifth toe here, I'm going to pinch that edge so that it makes one of those rucks we saw a moment ago. As it makes that ruck, not happy with the ruck being there because it, as I say, it's like a little pebble. So I'm going to trim that off, leaving me a nice flat surface over the lateral border of the foot. And this is another common place for blisters. And of course you can use this taping method to cover your dressing over there. Lateral border of the foot, as the foot hits the ground, slides forward in the shoe, slightly twist, that's how they get the blisters on the lateral side of the foot. At the base of the fifth toe now, what you should be able to see is just the tape is just starting to stick to the toe pad there. So we have to decide, can I stick that tape down into the toe fold so it's not going to come loose? Well, I can see the sticky side of the tape in this web space here. So probably the best thing to do is just pull that corner down, do a bit of cosmetic surgery on it. Just free it up so it's not going to catch. There, we know any of the toe, we've preserved the integrity of the tape so it's not going to come loose, it's not impinging in that fold. As I've done that, you can now see that the base of the fourth toe isn't quite right. It doesn't look tidy. That corner's going to catch, it's going to roll, and we're going to be in trouble. So pull that corner down, again, bit of plastics, trim it, stick it down. Now, starting to get happier and happier with this. What can you see here? You can see the corner of the fleecy web sticking out. Now in this particular area, I'm not too concerned. The weight bearing area of the foot is actually the ball of the foot down here. So this is going to take limited sort of friction and pressure and actually is allowing good range of movement in the toes. If I was concerned, we can do something called the bow tie trick, which is an invention of one of our medics from a few years ago. Take a square of tape like so and effectively make it into a bow tie shape like this, and this is all in real time, not sped up at all, so you can see how it is in real life when you're in the field at your checkpoint. Bow tie trick, not the most technical name for it. but we'll create a bow tie shape or an H shape. Peel the backing of the tape off, like so. Ooh, a bit sticky. Remembering that the tape likes to stick to itself, and you can run that between the toes and just stick it down like so. Again, obeying the principles, no or minimal corners, let it stick, and so on. Now what you can see here, that piece of fleecy web, and I've done that quickly so it's not the tidiest admittedly, but that is the principle. You've stuck down, you've reinforced the fleecy web there, you've kept away from the metatarsalophalangeal joint there. You have left a couple of corners here at the base of the big toe, that needs a prune, stick down. Okay, that's covered that piece of fleecy web, and in the web space there, I'm pressing down there to create a U shape to the tape so it sticks evenly to both sides of the toes. If I look at the runner's toes, what you might just be able to see is there is a gap there naturally, even when I apply running pressure on there, so it shouldn't chafe. If we look at the back of the foot now, which is slightly more awkward, and I'll just check you can see that in the camera, which you can, what you can see here is that the tape is overlapped in a slightly irregular shape. So I'm just going to peel this back, and this particular runner has not cleaned their feet since they visited the gym, so it's not sticking very well. But what you can see is that the medial portion of the tape is stuck over the back of the foot, and the lateral portion comes across and sticks down to it. Tape must stick to tape, it won't stick to just the foot. Tape must always stick to tape. So working from lateral to medial now, the little toe is free, and we prune that little folded edge off earlier, and I'm just going to take the corner of that off just to make it nice and round and reduce the risk of it peeling off and rolling. Moving across the foot, I'm going to check my bow tie there, and in an ideal world this lateral piece of tape folds over the top of that. Sometimes it's doable, sometimes it's not. It depends very much on the particular runner's foot. This edge up here, again, you need an edge. My personal preference is this corner here that extends up proximal on the foot, is to take that corner off and try and straighten it across there. The main reason for that is, as the foot supinates in the forefoot relative to the midfoot, that's the piece that tends to loosen and work its way off. So by trying to restrict the tape into the forefoot there, you're effectively constraining it to one portion of the foot, so the relative movement doesn't loosen it off. It is coming unstuck here a little bit. On the medial side, you usually get a slight bump here, the same way you had one laterally, a slight fold. So again, we're going to prune that off carefully with the tough cuts, and away we go. So what you can see now is we've got a nice smooth area, and the way I test it, close my eyes, just run my hand over the top. You've got the bow tie there, which should ideally be covered, and if it's not, you can do another layer of tape, just slightly alter the position to go over the whole lot again so that that is covered like so. I've got no corners over the top that's going to catch, and unfortunately if it does keep coming unstuck, if this was real life and it kept coming off, you're starting again. It's not acceptable that this tape's rolling off and the patient's not gone anywhere as yet. When it comes time to take this tape off, you are safe just to pull it off. As the patient's foot sweats or gets wet, or they tramp through the mud or whatever, that tape will loosen, it will soften, the glue will start to fade away, you can take it off. What doesn't come off so easily is the fleecy web, unless it's kind of been rubbed off. But fortunately in this case it's not fleecy web, and it's not a real blister. But that is how I tackle blisters in this zone of the foot. The bases of the toes, along into the web spaces with that bow tie trick, on the lateral border of the forefoot, occasionally on the medial border of the forefoot, tends to be in females, tends to be in those over about 35 as the toe goes into valgus there, becomes more prominent. And we'll talk about hindfoot blisters a bit later on, but that's the principle. Last couple of things to say. You often, and towards the end of a race, will get this whole area blistering, turning into one big blister. The principles are the same. You might cut your fleecy web into one big pad, following this pyramidal shape of the forefoot here. So that might be one whole big pad, you tape over the top, and you might need a second partially overlapped tape, which may extend into that midfoot forefoot junction we talked about earlier, but that's okay. There's always a balance of treating a patient and restricting their movement ever so slightly, and you have to strike that balance in your assessment. The final thing to say is socks. different athletes have different preferences with regards to their socks. Many will wear sort of standard socks that you would see in the shops, or you probably wear when you're out running yourself. Others will wear socks that have individual toe slots, and a common brand is Injinji. If they do wear those those toe socks, just bear in mind, if you fatten their toes up with dressings, for example, if you had a blister here, you fleecy webbed it, you did a circumferential dressing around the toe there, don't fatten it up so much that the toe of the sock won't fit on there. If you bulk it up too much, it will just rub on the next toe and cause a blister, and so on and so on. What I tend to do, if they don't wear toe socks, dress this blister, tiny bit of pad on the one next to it, because you're chunking up that toe. Same on this side, same on this side. You don't need to make a chain, so blister here, a little bit of padding there, and so on, just the two toes. If they wear toe socks, you don't need to do that, because the sock is taking the friction of the extra diameter of the toe, so it's not an issue. But forefoot blisters, that's how they're tackled in principle. Dead simple, roll of kinesio tape, fleecy web, pair of scissors of your preference. I prefer the big ones, but the little sharp ones are available in your checkpoint bags. Needles for bursting the blister, stirrup for cleaning it, some gauze swab to catch the blister fluid because it's pretty gross, and clean your hands before and afterwards. Any questions, then send me an email on brett@exilemedics.com, or there are other blister video tutorials here on the website, but you'll certainly get a lot of experience doing this out in the field, so good luck to you.